us see now what is the situation with the most vulnerable groups for which we were more compassionate for. And that's why I would really like to give the floor to Dr. Jane Muita, who is a representative of Unicef for Bulgaria. And Dr. Muita heads Unicef country office since June 2018. She is a national of Kenya and has served the United Nations Children's Funds for 21 years in various positions and in different African countries. Before joining Unicef, Dr. Muita was a senior lecturer in the University of Nairobi and undertook significant research in public health and nutrition, served as a pediatrician in her country, Kenya. Dr. Muita has a Bachelor of Medicine and Bachelor of Surgery and a Master of Medicine in Pediatrics from the University of Nairobi and a Master degree in Public Health from Johns Hopkins University in USA. Please join Jane, share your presentation. Happy to see you.
Okay. Yeah. Good evening. I hope my presentation is visible to all of you. And I will be starting to speak now. Actually, I'm really happy to have followed the presentation from the Dean and then the representative of WHO, because they have set the stage for many of the things that I would like to say. The first thing I would like to say is actually to appreciate the partnerships that we have had globally and in Bulgaria in support of the population during this pandemic. I think I agree with Dr. Sira that there are many unsung heroes, and those heroes will be acknowledged over time. But for this afternoon, I'll be speaking about the vulnerable group which we as Unicef globally represent and organize to make sure that rights are fulfilled, whether it is in normal time, in emergencies, and in times like this, when we are confronted with really a big problem. My structure of my presentation will be very simple. I will be looking at the current situation. Why are we worried? Then I will look at what would be the role of business. And finally, I will engage you in why Unicef is interested in working with business. Now, Dr. Sila has just talked about the numbers. We know that this pandemic is global and it continues to spread exponentially and is driving in numbers. It's increasing in numbers. He said that maybe this morning it was 4.1 million, but it increases all the time. And so many countries are affected, 212 at the last count. But organizations like UNICEF working with WHO, because WHO guides in terms of data and information and response measures, and working with governments and other partners, UNICEF is engaged in the global efforts to address the outbreak, but keep children and their families safe. Now, when we look at the numbers and when you listen to the statistics, most of the times people will be talking about the risks. It is a great risk to people aged 65 and those with pre-existing weakened immune systems. But it is important at all times to keep in mind the secondary impacts that this virus will have on children now and will continue to have on children for a very long time. If you look at the graph, if we positioned any of the other epidemics, this one is really different. You can see the contribution of this in Europe, in the Americas, and now it's also climbing in my continent, Africa. So it is not going to spare, and it's going to even hit hard on populations who are very marginalized and really in trouble. That is why UNICEF globally is calling upon governments to also start thinking or to continue thinking about protecting children. When we look at Bulgaria, the same phenomenon is going on. It is rising. The numbers are lower than, of course, what is happening in some of the other countries, but the trend is up and up. Now, why did I think that children should be the reason why we should look at the response? Because, and Dr. Sila has mentioned, when the problem affects families, and this one is affecting family income, it's making families poor. And then on top of that, protective measures are keeping families at home. Many of them have lost jobs. It definitely affects children significantly. And especially because in each and every country, there are children who are already vulnerable even before the COVID pandemic started. One of the areas that is really significantly affected globally is education. I'm very proud to be in Bulgaria because Bulgaria responded very fast in ensuring that children would have online classes. But there are still some who are not able to reach the online platforms. This includes children in very vulnerable and poor situations, and also children with disability, and those are a concern. Then, of course, we know that the elderly are at high risk of the infection, and yet, in countries like Bulgaria, they also contribute to care for children. So when they are kept protected, it means that one care person may not be available to help care for children in the world. Now, if we look at that situation, which presented by Dr. Sila earlier, and I have just emphasized, then we need to do things together. And when I focus, with UNICEF, we focused a lot for many years, working with governments, working with our NGO partners. But more importantly, in the last few years, we have focused on business because business has the capacity to unlock a lot of opportunities for achieving children's rights. In the case of COVID, we know that first and foremost, protecting their staff, the staff that are in the community of business, the communities that they are involved in, their clients, by prioritizing the things that Dr. Sila talked about, containment and following those recommendations is one step in making sure that we can protect children. This would include raising awareness even among staff, among communities, and this has happened. It has happened, but still needs to continue happening. Putting in place workplace policies for doing business during COVID. These are so important, especially for parents who are working for different businesses. Some of them could even be breastfeeding, and they need to be breastfeeding even as they work. And we are talking about now, and as we move towards the future, because like Dr. Sila said, COVID is here with us. COVID-19 is here with us to stay. Then, of course, updating business continuity plans for companies and suppliers. Very important because this is a whole community that requires to work, but yet the business plans must respond to the needs of preventing and protecting themselves from COVID. The other most important area that globally and also in Bulgaria is important is contributing to national and global efforts. There are various solidarity mechanisms for contributing to financially, in kind, and also contributing in joint advocacy. This is happening. It's already happening. But as we move towards the future and where we are thinking about greater efforts, we really need to join hands in order to deal with the problem. I would like here to acknowledge that during this COVID crisis, we have had very good response from business with in-kind donations, which have managed to help us reach out to children to attend school, to communities with hygiene parks, with educational materials, including for children with disabilities. But the problem is much, much bigger than we can handle alone. So we will continue to work together and invite communities, including academia and business to take their position. For business, protecting customers, and here we are talking about customers and workers, and I wanted to highlight when we are talking about workers, it's not only the workers that are directly employed by the business. They could be others that work for them, contractors, and even informal workers. How do we protect those ones? Communities that they exist in. And we are talking about the current infections and also future infections, adhering to some of the things that Dr. Sila talked about so well. But we know that business sector has a key role to play in support of governments. It doesn't matter whether we are in Bulgaria, but in governments across the world. Because they contribute to health and safety, especially when they protect their human resources. In this case, protecting them, the community and the clients, prioritizing containment, and Dr. Sila talked about those kinds of things, raising awareness on prevention and transmission, and of course the policies that I talked about. And soon we shall be talking about travel policies, looking at telecommuting, looking at social distancing as we move towards reducing the measures. How do we do that? And that also impacts on the children that the people who the businesses work with are also looking after. Reporting symptoms. When they happen in the workplace or they happen outside the workplace, they finally touch on children. Then, of course, like I said, updating business plans. For families and children, awareness is critical throughout, whether it's by putting up materials in the companies showing transmission, prevention measures, or is sharing with them information from the websites, key and important. But most importantly for us is instituting family-friendly business practices, because these ensure that children continue to be taken care of despite the pandemic as it continues. Finally, what else could they do? Of course, financial contributions. And we are talking about financial contributions that are looking at Solidarity Response Fund, whether it's local or global, that will put in track, ways to stop the virus, or also ensuring care according to the needs of the country and the people that are getting infected. Shopping, shipping, buying, and availing all the necessary protective equipment. And of course, contributing to what is most critical that will stop this virus: treatments, vaccines, and tests. And this is critical. It means that both individuals and business have to come into play in order to support these kinds of actions. When we move from there, we look at the recovery phase. And this is going to be critical. During the recovery phase, the UN, again led by WHO and the whole United Nations, is looking at how we tackle not only the emergency, but how we look at what the social and economic impacts are going to be and how they are going to influence the recovery. If these don't recover, then children end up dropping out of school. Already some of them were out of school. Others will be malnourished globally, I guess, and also in the country. And they will have many other issues that we may have to deal with that will interfere with the creation of the human capacity that we require in the future. So we will need to put into place some of the actions that will protect and prevent children from falling outside the development paradigm. In summary, this would be making clean workspaces. I think Dr. Sira already talked about it, and doing all these other things that I have listed here and I'll share with you. But also, the last one is protecting the workplace against discrimination and social stigma. This particular pandemic has led to some form of social stigma, and we will start seeing this increasing as people return to work and how they react to their colleagues who have experienced the disease or who may have symptoms like cough or even difficulties in breathing. And some of these things we will have to deal with as we work in whatever environments that we work in. I will give you this slide, this presentation, and there are very many references that help businesses to understand some of the areas that they could deal with, whether it's in family-friendly policies, how to deal with children at home or in the work environment, but that will be available for you. I wanted to get to this slide. Why is UNICEF engaging with business sector? We started this, UNICEF has always worked with business since the time when UNICEF started working, because we are the major providers across the world of vaccines or various drugs. So we have worked with business in order to improve the market for various commodities that save children's lives. But since 2019, we are looking at how we can work with business differently in order to unlock the wealth of knowledge, the wealth of capacity, the wealth of support that can enable children and populations to benefit from the reach that business has. And this can be at the workplace, it can be at the marketplace, and it can also be at the community. These actions are actually articulated in what we refer to as the business and child rights principles, which are defined from the business and human rights principles. But many times when we talk from the United Nations and we talk about children's rights and business always would ask, but what is there for us? When these principles are applied at the three levels that I have mentioned, business also gains. They achieve better risk management, they build reputation, and they achieve a social license to operate. They are able to recruit in the future. If we investment right now, you're able to recruit motivated workforce. They're able to develop generation and talent. And again, they're able to contribute to stable and sustainable development, business development environment. So essentially there is benefit, but investment has to happen from the very beginning. This is a very simple business principles, child rights and business principles analysis that we use as a wheel, and there are 10. This again, one can refer to and look at, but most importantly, it means that it is not only that we can say that business impacts on children through child labor. Business work is able to interact and to affect children in all those three areas of this wheel. And if we work together, we can actually achieve great results for children, whether it's during the COVID time and beyond, because COVID will come and pass. I would like to give you this statement, which comes from our executive director. It says that the business sector interacts with children on a daily basis. Business impacts a wide range of children's rights beyond child labor, but it also has enormous power to improve the rights of children and protect them from harm through the way in which it treats employees, operates its facilities, develops and markets its products, provides its services, and it exerts its influence on the economic and social development. But in the case of COVID, the pandemic calls us to do even more than just what we were talking about in 2019 when we had not gotten into this particular problem. Now, how does UNICEF Bulgaria work in this time of COVID? We look at fostering partnerships, and that is why here on this platform, we have the academia, we have our other UN partners, and we also have the business partners, because those are the ones that would help us to support children and families. And these partnerships are really important. Sometimes they are not just in terms of finance, they can be technical, they can be in terms of in-kind donations, or they can be just that we share together and develop shared value partnerships that give us a win-win situation. Then we also generate innovative approaches to get all children learning. For example, at this moment, we are working with our business partner to develop a platform that will enable children with special needs to continue learning during this time. As you know, children with special needs need to interact with their resource teachers, with other teachers. Maybe it might be a speech therapist, a psychologist. Those platforms are not available. But if we are able to work on this one, we'll be able to provide resources that can help this interaction to happen. We mobilize resources as well to support the response. And this, I'm talking about mobilizing locally, but also mobilizing globally. Because as I showed in the first slide, the pandemic is everywhere. And there are many other countries that even the resources are not available, even for healthcare and public health. Then finally, we engage, we provide data and evidence, and we provide technical guidance using that data for decision making. And here we are talking about working globally, working nationally, and also working at municipal and community level. So we do reach a very wide range of areas that we can actually have an impact on children. But there are also tools that are available globally that can be used. And here I would like to acknowledge the United Nations Global Compact. They have a coordinated international response that involves business sector, and they have some of the tools that you can use for every decision maker, especially when you use the 10 principles of the United Nations Global Compact, which will give ideas to business, especially in these times, giving inspiration and possibilities for even doing better. I would like to add there, because if I wanted to talk, I could talk the whole day, because the impact of COVID on children is rather silent, because we don't see the numbers of death, but the impact is bigger and it will last much longer. So that is why we are calling upon each and every one to also focus on this vulnerable group, the children of the world and the children of Bulgaria. Thank you very much.